I'm a breast surgical oncologist. I chose that field because during my time in general surgery training, I found that my rotations in breast cancer surgery were the most fulfilling and what I was really looking for in a career. I was born and raised in Houston. My parents are physicians in the community here, so I've known about MD Anderson for a very long time. But it was really during my training when I realized how important the multidisciplinary care was to really providing patients with the best options for treatment. Because breast cancer care is so complicated and it really does involve multiple different physicians from different specialties, I think the ability to really be able to reach out to those physicians is very important, and I found that it is incredibly easy. It's just as easy as making a phone call or showing up down in clinic. We all are on the same page about really trying to provide the best treatment for the patient. So I think that that sort of integrated care that is so available and right next door is really important. That's what makes this place so unique. I think it's really important to listen to the patients. I think that sometimes we go in with some recommendations, which some patients appreciate, but I think that physicians and patients oftentimes have different goals of care, and it's really important to listen to what it is that they want and what's important to them and their quality of life. So that we can form a good shared decision plan for treatment. I want patients to know that I truly am listening to what it is that they have to say about what their priorities are. And I want them to know that my goal is to give them the best treatment and that their outcome is my outcome. I'm Nina Tamirisa, and I'm making cancer history.